I'm gonna show you the second bone of the lower limb. This is called femur. It's the main bone of the thigh, and it's a long bone, as you see here. It's one of the longest bone of the body, and so it has two proximal and distal ends, and it has a shaft here. At the proximal end, as you see here, it has a big head, and it articulates with the acetabulum of the hip, and it makes hip joints, you see here. And in the head there is a depression which is called fovea. Fovea means small fossa, and it gives an attachment to the ligament of the head of the femur. There is a ligament here, attaches here, and it also goes down and attaches here to this transverse acetabular ligament. So here is a fovea. Ligamentum of the head of the femur links the fovea of the femur to this ligament, transverse acetabular ligament, from this to this. And I will show you here. As you see, here is the femur, the medial side of the hip removed, and you can see the head of the femur, and here is the number 8 is the ligamentum of the head of the femur that links the fovea of the head to the acetabular, transverse acetabular ligament, as I showed you before. And then next to the head we have a big neck. It has a quadrangular shape, two surface, anterior surface, posterior surface here, superior border, inferior border, and it has two bumpy bony bits. One of them is so huge. Here you can see. It is called greater trochanter. Trochanter, the word trochanter means like a runner, and it is the most lateral point of the bony point of the femur, so you can palpate it on yourself. It's completely palpable, and it gives attachment to lots of muscles here. So here is the greater trochanter on the most lateral side, and we also have a small trochanter slightly posterior. It's placed slightly posterior, you see here, lesser trochanter, and some muscles attach here, which is called iliopsoas muscle. I will show you. Here is the iliacus, here is the psoas major, and they passes beneath the inguinal ligament, under the inguinal ligament. This is called iliopsoas muscle, and they attach to this lesser trochanter. Between these trochanter anteriorly, there's a line. You see here, greater trochanter, lesser trochanter. There is a line. It gives an attachment to the capsule. We have a articular capsule of the hip joint. It attaches to this line. It pulls on this line. But posteriorly, instead of line, we have a crest. Between these two greater and lesser trochanter, we have a intertrochanteric crest. Inter means between. Intertrochanteric crest, intertrochanteric line anteriorly. So then we have shaft. Here's the shaft of the femur. Anteriorly, as you see, it is smooth, but posteriorly, on the posterior surface of the shaft, we have a ridge, which is called linea aspera. Linea aspera. Lots of muscles attaches to the linea aspera. I mean, you see here, we have these muscles, vastus lateralis, medialis, abductor muscles, and some of the hamstring muscles. All these muscles attached to this linea aspera. If you go up at the top, you can see a rough area here, Here is a rough area. It is tuberosity. Then the gluteus maximus attaches. So here is the gluteus maximus. Its tendon attaches to this rough area. That's why this rough area is called gluteal tuberosity. And if you look at here, imagine that my hand is gluteus maximus. It's coming from the ilium and sacrum. Its tendon attaches here. That's why here is called gluteal tuberosity. And on the medial, we have spiral line, and the vastus medialis attaches to the spiral line. Here is the quadriceps femoris muscle. As its name suggests, it has 4 heads. The medial head is called vastus medialis. Vastus medialis attaches to the spiral line. So gluteal tuberosity for gluteus maximus, spiral line for vastus medialis. And next to the vastus medialis, we have pectineal line. It's not visible actually in this model, but parallel to the spiral line, lateral to the spiral line, we have pectineal line. The pectineus muscle attaches. You see, as I showed you, here is the pecten pubis and the superior pubic ramus. And we also have pectineal line here. Between these two pectineal line, we have pectineus muscle. I'll show you pectineus muscle. Here is the pectineus muscle. Superiorly attaches to the pecten pubis of the pubis. Inferiorly, it attaches to the pectineal line. It is next to the spiral line. So, inferiorly, linea aspera separates with these 2 lines, which is called supracondylar line. Here is the condyle, lateral condyle, medial condyle. If here is the head, so here is the medial side, here is the medial condyle, here is the lateral condyle. Above the condyle, we have line, supracondylar line, medial supracondylar, lateral supracondylar. These 2 lines surrounds this area, which is called popliteal area. Popliteal is an area at the back of the knee joint. Here is the knee joint, and here is the popliteal area. So in the bottom line here is the linea aspera. If you go up, you can see gluteal tuberosity laterally, spiral line, and pectineal line medially. If you go down, you can see 2 supracondylar line, lateral supracondylar and medial supracondylar line. And between these 2 lines is called popliteal area. And the distal end, as I mentioned you, it has 2 condyle, medial and lateral condyle. It has an articular surface for the tibia, as you see. And between these 2 condyle, there is a fossa, which is called intercondylar fossa. Inter means between, condylar means between 2 condyle. It allows the popliteal artery and vessels passes through this intercondylar fossa to the leg. And then we have epicondyle. Here is the epicondyle. Condyle, epicondyle, lateral epicondyle. This is condyle, epicondyle. Some ligaments attach to the epicondyle. You see here. Here is the condyle. Here is the condyle. Here is the epicondyle. You see here medial collateral ligament attaches to the medial epicondyle. Here is the lateral epicondyle, lateral collateral ligament or fibular collateral ligament attaches to the lateral epicondyle. So on the medial side, here's the medial epicondyle. We have a projection, upward projection here, which is called adductor tubercle. It is palpable, and the biggest adductor muscle, which is called adductor magnus come down and attaches to this adductor tubercle. So, as a quick recap, we have two condyle, intercondylar fossa, two epicondyle for collateral ligaments, and above the medial epicondyle, we have adductor tubercle. At the front, we have an articular surface for this bone, which is called patella. It's the biggest sesamoid bone of the body. It has a triangular shape. It has a base above and apex below, and anterior surface is rough, but if I turn it over, the posterior surface at the top has an articular surface. It is smooth. It articulates with patellar surface of the femur here, like this. Yeah. Thank you.